This project is a collaboration between Rajdhani Hospital and Sinfeet Hospital.
Obesity is a growing global issue caused by factors like consuming high-calorie foods, lack of exercise, stress, and an unbalanced lifestyle. Obesity not only affects appearance, but also increases the risk of chronic diseases such as diabetes, high blood pressure, heart disease, kidney disease, and cancer. Dr. Wiradek Lertdamrongrak, a specialist in bariatric surgery, treats obesity through one of the most effective methods, which is bariatric surgery. His commitment is to provide long-term weight control and prevent complications. The main goal of bariatric surgery is not beauty cosmetic, it's to improve physical health, enhance quality of life, and reduce the risk of illnesses caused by obesity.
Hi, I'm Arani Patanasang. Before surgery, I weighed 120 kilograms and had many health problems. My diabetes was out of control, with blood sugar levels reaching 350, and I had been injecting insulin for over 5 years. I also suffered from fatty liver, high blood pressure, osteoarthritis, and gallstones. At night, I constantly had to get up to urinate, leaving me exhausted and causing issues at work. My life became incredibly difficult. I felt like a burden to my family. My husband eventually left, and our family broke apart. I was devastated. I tried to diet, exercise, but nothing worked. I only became more stressed, and my weight kept increasing. Then my doctor suggested bariatric surgery. At first, I hesitated, but when I thought about my future health, I wanted to prove to myself that I could do it. I wanted to be there for my loved ones. So, I made the decision to undergo bariatric surgery with Dr. Wiradek to be with my family for as long as I can.
Dr. Wiradek Lertdamrongrak, a specialist in bariatric surgery, treats obesity through one of the most effective methods, which is bariatric surgery. His commitment is to provide long-term weight control and prevent complications. The main goal of bariatric surgery is not beauty cosmetic, it's to improve physical health, enhance quality of life, and reduce the risk of illnesses caused by obesity. Dr. Wiradek Lertdamrongrak holds a Bachelor of Medicine and further specialized in general surgery, receiving training from leading medical institutions both in Thailand and abroad. He is recognized as an expert in bariatric surgery, a vital treatment for individuals with severe or chronic obesity. Over the course of his career, he has mastered highly complex surgical procedures, consistently providing effective care to his patients. With more than 30 years of experience, Dr. Wiradek has performed between 3,000 and 4,000 bariatric surgery cases as of 2024.
Hi, my name is Fachikorn Duengsingrit. I used to be severely overweight, reaching up to 220 kilograms, with blood pressure as high as 210. I had been overweight all my life, but I never really saw myself as fat. I guess I just got used to it. That changed when I started experiencing sleep apnea, and my blood pressure became dangerously high. I could no longer live a normal life. I would fall asleep while sitting at work, and I even broke several chairs. So, I started exploring different treatment options until I came across bariatric surgery. I consulted with several hospitals, but many refused to treat me as I was overweight. My BMI was 63.30, and my blood pressure was still dangerously high at 210. Then, I met with Dr. Wiradek. Unlike the others, he didn't hesitate to take on my case, and I made the decision to go ahead with the surgery right away.
Dr. Wiradek's goal with bariatric surgery is to help people struggling with obesity who can't lose weight through traditional methods like diet and exercise. This surgery not only helps with weight loss but also reduces the risk of complications related to obesity such as diabetes, high blood pressure, and heart disease, which can lead to serious health problems in the future.
After researching bariatric surgery for 2 years, I finally went to see Dr. Wiradek for a consultation. He walked me through every step in detail, such as how to prepare before the surgery, how to take care of myself afterward, the right diet and exercise plan, and most importantly, he provided constant encouragement. He was always by my side and never left me throughout the process. With his experience of performing over 3,000 surgeries and the use of equipment that meets international standards, I felt confident and trusted Dr. Wiradek.
After consulting with the doctor, he had me stay in the hospital for a week to control my weight before the surgery. I lost 3 kilograms during that time and then starting the process of bariatric surgery. Since the surgery, My life has improved by 300%. It's been 1 year and 2 months and I've lost 106 kilos. My BMI is now 32 and my blood pressure has dropped from 210 to 110.
Bariatric surgery has two main approaches. The first is to reduce the size of the stomach. First is sleeve gastrectomy, where about 80% of the stomach is removed. This helps patients feel full more quickly. The second approach changes the digestive tract to reduce how much food is absorbed, like in bariatric surgery. I prefer sleeve gastrectomy because it doesn't change the digestive system in a way that causes vitamin deficiencies, so patients can continue to live a normal life.
I feel incredibly fortunate that I have met Dr. Wiradek. He truly gave me a new lease on life. He provided me with thorough advice, and even when I had a lot of questions, he never dismissed them. After the surgery, he personally called to check on my progress and made sure I never felt abandoned. The medical and anesthesia teams took a good care of me. When it was time to enter the operating room, I felt completely at ease and my confidence was overwhelming. I lost almost 40 kilograms and my health has greatly improved. My weight has decreased and my blood pressure is better. I can walk more easily and don't tire as quickly as I used to. I no longer need to inject insulin. Most importantly, I feel more confident and beautiful. I never imagined I could change this much, and I'm excited to get back to work that I love.
I am very proud of myself for successfully losing weight according to the goals set by my doctor. Undergoing bariatric surgery is a challenging decision that requires both physical and mental strength. For those considering this surgery, I encourage you to stay determined and patient throughout the process. Every change you make can lead to greater happiness and better health. Remember to encourage yourself and allow time for recovery. Surely, you can achieve your goals.
I am dedicated to caring for patients who are overweight or obese through bariatric surgery, aiming to help them achieve sustainable health and reduce the risk of complications associated with obesity. Beyond the surgery, I emphasize the importance of long-term care, including helping patients change their eating and exercise habits so they can regain their quality of life.